Good afternoon. Today we are going to talk about two male-specific cancers, prostate and testicular cancer. First, we're going to talk about prostate cancer. Just a couple facts about prostate cancer before we get started. It is the most common among men, second to skin cancer. It is more common in African American men older than 65, and Asian American men are at lowest risk for getting it. It is a very slow-growing cancer. Many men go undiagnosed, and many choose to not seek treatment once they are diagnosed. The earliest stages often have little to no symptoms, and the symptoms of it include weak or interrupted stop-and-go flow of urine, a sudden urge to urinate or frequent urination, trouble starting urine or emptying bladder completely, painful burning urination, blood in the urine or in semen, pain in the back, hips, or pelvis, breathlessness and tiredness, dizziness, and anemia. And then there is a visual image of the prostate.
Hi, my name is Jenny, and I'm going to present two possible precancerous conditions of the prostate, as well as some screenings for it. Two possible precancerous conditions of the prostate are intraepithelial neoplasia and proliferate inflammatory atrophy. PIN is the abnormal growth of cells and usually satisfies all the requirements to be considered a premalignant condition. A high-grade PIN is widely accepted as a precursor to prostate cancer. PIA is the inflammation around or in the area of the prostate and can cause an increase in PIN grade. Research has shown that both have correlation to prostate cancer. There are two major screening tests for prostate cancer. The prostate-specific antigen screening and the digital rectal exam. Both of these tests are only to give probable cause to look further into the possibility of prostate cancer, and abnormal findings are not diagnostic of prostate cancer. The PSA screening is a blood test in which a higher level indicates a higher chance of prostate cancer.
Hi, I'm Kim, and I'm going to finish information about the screening. Most physicians and organizations recommend yearly PSA and digital rectal exam screening, beginning at age 50 for those with normal risk for developing prostate cancer, and at age 40 to 45 for those with an increased risk. As stated before, the screenings are only a probable detector of prostate cancer, and biopsy is necessary for diagnosis. As you can see, there are a few different treatment options for prostate cancer, and treatment varies by patient, as in any cancer treatment plan. When seeking treatment for prostate cancer, it is important to weigh the benefits compared to the risks and side effects. Because prostate cancer is typically a slow-growing cancer with little to no symptoms in the early stages, patients frequently choose to utilize observation, also known as watchful waiting, or active surveillance to monitor the cancer very closely for changes and progression. Active surveillance usually involves PSA screening every 6 months, digital rectal exams yearly, and imaging or biopsy every 1 to 3 years with changes in symptoms.
Hi, my name is Misty, and I'm going to go over some risk groups for some of the men that are at risk for prostate cancer. As you'll see here on the slide, the age ranges are rare in men that are younger than 40, but chances rise as they reach age 50 and on up. There is 6 out of 10 cases occur in men older than 65. Prostate cancer is more common in North American men, probably due to the emphasis on screening and diagnosis that's available in North America. Prostate cancer is most common, however, among African American men over the age of 65. Chances rise with age. Prostate cancer is considered hereditary, and risk also rises with genetic conditions, things like Lynch syndrome. Here on the next screen, you'll see prostate cancer statistics in American men. And I just want to point out a couple here that there are only 3% that actually die from prostate cancer. And a little known fact that there is 2.7 million living with prostate cancer. Also here on the next screen, you will see some of the risk factors. However, they are not conclusive. They are not yet definitive. Some things that could put them at risk would be diet, things like dairy and the calcium that can put them at risk. Things like obesity, though it is a low risk, and you would see a low grade at that time. Things like smoking or chemical exposure. People like firefighters or military personnel that have been exposed to those kinds of chemicals, such as Agent Orange, they also can be at risk. Any kind of things that would cause inflammation in and around the prostate and reproductive organs, things like STDs, even vasectomies can put them at risk as well.
My name's Erin. I'm going to go over some of the stages of prostate cancer. We have stage 1 where the cancer is relatively small. It's confined to the prostate and tends to grow very slowly. In stage 2, the cancer is still confined to the prostate, but it's more likely to spread after it gets to that stage. In stage 3, the cancer has spread beyond the prostate, but not into the lymph nodes yet, or other organs around the system like the bladder or the rectum. And in stage 4, the cancer has spread to nearby areas such as the bladder, rectum, and lymph nodes, or to distant organs and sometimes even bones. It's typically diagnosed between stages 1 and 2. That's when symptoms begin to occur, but a lot of patients don't have symptoms, and that's a big reason why you have such a high number of men who go undiagnosed, because they have no symptoms to show. On this next slide, we're going to talk about prevention with early screening. One of the main goals of any health issues you have is you want to stay active. You want to be exercising, remain as healthy as possible. You want to maintain a healthy weight. And some medications they've seen have been used to prevent. It's not proven, but 5-alpha reductase inhibitors such as finasteride and dutasteride are drugs that are used to treat BPH, and another condition that affects the prostate. Aspirin needs a little more research, but it's also been shown to possibly reduce your chances. But yearly screening is the most important to catch this cancer before it progresses past the prostate, or before symptoms become significant. And while it is true that a lot of men live with this cancer, they live with it, they don't die from it. So that's one good thing.
Hi, my name's Danielle. I'm going to talk to you guys a little bit about testicular cancer. This is also another male-specific cancer. While mostly older men are the ones with prostate cancer, testicular cancer is usually found in younger men. It's the most common cancer in men that are younger, typically diagnosed between 15 and 35. One of the main risk factors for this cancer is having an undescended testicle, and testicular cancer is generally found through self-examination. Some different types of testicular cancer are the most common is germ cell tumors. There's also seminomas and non-seminomas. Seminomas are the ones that progress a little bit more slowly. Carcinoma in situ of the testicle, and secondary testicular cancer, which occurs when cancers have spread from somewhere else in the body to the testicles.
I'm Emily, and I'm going to talk about screening and the treatment. As far as screening, the best thing to do is to check yourself pretty much daily, usually whenever you're in the shower, and I'll show you guys how to do this. So you want to feel both and make sure if there's any hard spots or anything that's not normal between the two, because they should be pretty similar. And if you have anything that sticks out to you or feels abnormal, you want to make sure that you go in for more screening. Treatment can be surgery, which you get a testicle removed, and after the surgery you're usually going to have radiation and chemotherapy, and then we usually take care of that.
risk groups that go with testicular cancer would be undescended testicles, part of your family history, as well as HIV infection. Another risk factor would be carcinoma in the situ of the testicle, as well as previous history of the cancer. Certain races and ethnicity tend to have it mostly common in white men, as well as body size, obesity can contribute. Other risk factors would include early onset of puberty, prior injury or trauma to the testicles, as well as being taller versus your height. Another way, or some prevention methods for men would be many men actually have no known risk factors, or they do, but they can't be changed. And so many cases of testicular cancer are actually not preventable. Some improvement risk reduction factors are adequate exercise, which pretty much goes with any type of health maintenance, wearing loose underwear, and correcting an undescended testicle within a timely manner. So it's definitely something you want to do self-exams on. And none of these have any scientific evidence, but they do believe that they reduce the development of testicular cancer.